In this video, we're going to talk about some common work-related musculoskeletal disorders. Again, this is part of our ergonomics unit in the first industrial hygiene class, 3423. Like I've said before, I do recommend you take a full-blown ergonomics class because it is a very important topic for safety professionals, especially the physical ergonomics. The branch of ergonomics that deals with work-related musculoskeletal disorders. And I'm not going to redo the first two videos and explain why it's important. You should have already seen that. We're going to talk about, again, common work-related musculoskeletal disorders. We're not going to talk about everything. This is not a class in orthopedics and orthopedic disorders. Most of these different disorders that we're going to talk about, I've had workers experience these conditions, and you probably will in your career also have workers that experience carpal tunnel syndrome or degenerative disc disease or other of the wide variety of back disorders that are out there, tendinitis, medial epicondylitis, lateral epicondylitis. And these are common. You're probably going to see them in your career. One thing I do want to stress, and I'm sure I've mentioned this before in the class, we are not medical professionals. As safety professionals, it's not our job to diagnose illnesses or recommend treatment for illnesses. So we should not be pretending to be a medical professional. We should not be offering a diagnosis. I mean, our knowing about these disorders is good. We can use that knowledge to help workers, but we need to leave the medical work to the medical professionals. The reason I emphasize this, in my career, I've ran into a few safety professionals that you would think they were medical professionals by the way they talked, by their propensity to provide diagnoses and provide treatment recommendations. You know, they were doing everything but prescribing medications and performing surgery on these workers. Again, we're going to talk about the symptoms of different disorders. If a worker complains of certain symptoms, we may recognize those symptoms as symptoms of carpal tunnel disorder. What we should do then as safety professionals is refer them to a medical professional that, leave the medicine to the doctors and the nurses and the physician's assistants. That's not our role. We work with those professionals, but when it gets to a certain point, we need to pass off the injured worker to those individuals that are better trained than we are. So, all right, that's my preaching moment for this unit. You don't pretend to be doctors. One of the most common types of disorders that you're going to encounter is a simple muscle strain or maybe a more severe muscle tear. Muscle strain can range from a grade 1, a minor strain, to a grade 3, a severe tear. What we're talking about here is a damage to muscle fibers, usually the result of overexertion, or repetitive loading, or posture, or all three of these combined. We'll talk about this more when we talk about prevention measures, but one method that is pretty well proven for preventing muscle strains or muscle disorders is simply warming up and stretching before any strenuous activity. The catchphrase for this warm up and stretching, the catchphrase that you'll hear in industry is stretch and flex. Warm up, stretch, get the muscles ready to work. And more on that in the prevention video. Muscles that are injured do need that recovery time. They need that time to heal. If they're not given time to heal, it could turn into a cumulative trauma disorder that's more serious, that will even be more difficult and take more time for it to heal up. So And again, as a if a worker comes to you complaining of soreness, hey man, I'm really wiped out after shoveling concrete all day yesterday. My arms are sore, my legs are sore, my back is sore, and if it seems to be a muscle soreness, again, we don't want to be doctors. We don't want to recommend treatment. We might want to recommend them to a medical professional, but it could be that in those circumstances they just need recovery time for their bodies to heal up. And the difficult thing is that in a lot of industries, workers are never given time to heal up properly. They're shoveling concrete on day one, they're still sore on day two, and they're back to shoveling concrete, and that's just exacerbating the injury that occurred on day one. They're not given time to heal up. But muscle strains, muscle tears, common in a lot of different industries. Guyon tunnel syndrome. This is a hand-wrist disorder. It's characterized by numbness and possibly pain in the pinky and ring fingers. It's a little bit different than carpal tunnel syndrome. It's very similar, but it is a little different. With Guyon tunnel, it's the result of the ulnar nerve, this nerve right here, being pinched as it passes through the Guyon tunnel or the Guyon canal. And you're going to see symptoms. Workers are going to have symptoms in their pinky and ring finger if it's the ulnar nerve that's being affected. Carpal tunnel syndrome, on the other hand, that is going to be an impingement of the medial nerve or the median nerve. You're going to have a lot of the same types of symptoms, but different fingers are going to be affected if it's carpal tunnel syndrome. Again, carpal tunnel syndrome, often the result of swelling of structures around the carpal tunnel. As the swelling occurs, the carpal tunnel is reduced and the median nerve is affected. May also result from medical conditions. Again, it's usually when we're talking about either of these disorders, it's because of working with your hands. And it's not, and again, not heavy work necessarily, but maybe it's repetitive work. Maybe it's a repetitive work with your wrist flexed out of that neutral position. Again, ideally, your wrist as you work is going to be in the neutral position that we have here. But if it's flexed down 30 degrees, up as far as 30 degrees during the work task, that's more likely to result in either of these different syndromes. What else can I say? In pinky and ring fingers, for Guyon, carpal tunnel, it's more likely to be your index finger and your middle finger. Oddly enough, the median nerve supplies the ring or the index finger and the middle finger, so it's more likely to be affected when you have impingement in that area. Again, numbness and pain, similar to what you have with the Guyon tunnel syndrome, is going to occur. The occupations most likely to develop these syndromes, like I said, are occupations where the hands are used, assembly work. It could be carpentry. It could be office work. Office workers who do a lot of data entry with a keyboard are highly susceptible to these disorders, and a lot of that, the development of these disorders in office workers is because of the position of the wrist for extended periods of time. There can also be the development of these disorders from overexertion, but usually it's repetitive motion types of tasks that result in these disorders. Again, very common. If you remember our data from the first video, carpal tunnel, about 5,000 cases a year occur in the United States. And there are enough carpal tunnel cases occur each year in the United States that it makes it onto the Bureau of Labor Statistics lists of workplace injuries. Tendinitis, spelled two different ways. You're going to see it spelled this way or this way. Either way is fine with me. It's an inflammation of a tendon. Remember, a tendon is the soft tissue that connects muscle to bone. Tendinitis, this inflammation, could be due to an acute overexertion or of a traumatic injury, or it could be the result of repetitive motion, cumulative trauma. Posture may play a role. Over-articulation may play a role. Again, a combination of risk factors can result in tendinitis. And there are pretty much any tendon in the body can be affected by this type of inflammation. One thing for us to remember, and for employers to remember, if their employees are diagnosed with tendinitis, some form of tendinitis, tendons are very slow to heal and are easily re-injured. Even surgical repair may be necessary in some cases. But workers should be sensitive to a tendon injury and not push workers back into a strenuous activity too soon, because that could result in a re-injury or making an injury worse than it was before. Now the chart down here at the bottom, this gives us some idea. Again, this is we're talking averages here. Different injuries are going to require different healing times. But if we consider this point in the graph as the onset of the injury, it can be up to 12 months later. It can, or some people it's going to be longer, some people it's going to be shorter, but very lengthy healing time for a tendon injury. And we'll talk about this a little bit more when we talk about specific tendon injuries like Achilles Tendonitis. Tendinitis is a general term. There are more specific disorder labels that are used depending on the specific tendon that is inflamed, that is injured. Lateral epicondylitis, you've probably heard of it as tennis elbow. It's a painful inflammation of tendons on the outside of the elbow. It can be due to overexertion, repetitive motion. It's a tendon, so it's slow healing and easily aggravated with continued activity. Again, sometimes it can require surgery. Again, lateral epicondylitis. Anytime you see the word lateral, that's referring to the outside. Medial refers to the inside. So if it's lateral epicondylitis, that's the outside of your arm, the outside of your elbow. If it's medial, it's going to be the inside. You probably can't see me doing this on my camera, but it is illustrated here in the diagrams. Again, this is the outside of the elbow. This is the inside of the elbow. Lateral and medial epicondylitis are pretty much the same disorders, but it's different types of movements that results in these disorders. Medial epicondylitis, the slang term for this disorder, is golfer's elbow. Golfers do develop this. Golf swings, especially bad golf swings like mine, places stress on those tendons, the inside of the elbow, on the inside of the elbow. Again, overexertion, repetitive motion are the most likely risk factors associated with the development of this disorder and the other disorder. Tennis elbow is also referred to as carpenter's elbow. Golfer's elbow is also referred to as carpenter's elbow. A lot of the trades, especially trades like carpenters that may use hammers or other tools, they can develop these disorders. Weight training, during weight training activities, these disorders can develop. My bout with tennis elbow was it wasn't an accident in the weight room, but it was I overdid it. It was 6 months before it healed up, before I was back to normal. once I develop the inflammation in these tendons from overdoing it in the weight room. And in the workplace, it happens too. Workers overdo it. The tendon is damaged, it's inflamed, and it can take an extended period of time for it to heal up. And maybe the most important thing, or most important takeaway when it comes to tendinitis, is just realizing how slowly it does heal up. And myself, I tend to be on the conservative side when it comes to medical treatment. If I had a worker complaining of this symptom, either the medial or the lateral epicondylitis symptoms, I'm going to refer them to a medical professional, even though I know that it will probably heal up over time if they're required to rest. But if they continue to do the activities, perform the activities that resulted in the injury, it's not going to heal up. And that's the reason I would send them to a medical professional. I want the medical professional to prescribe rest for the worker. I want the worker to have a prescription that says they need to rest this area of their body, because that's really the only way it's going to heal up. If you try to, if you're a carpenter that's sustained the injury from swinging a hammer, you keep swinging a hammer, it's never going to heal up. You got to have that recovery time, the healing time. Now this one, I really only include this for you baseball players who are in the class. This is more of a traumatic type of injury than what we would normally deal with when it comes to ergonomics. This is a torn ulnar collateral ligament resulting from repetitive force. It can also result from explosive movements. It is a type of injury that's common to pitchers. It's the ligament on the inside of the elbow. The ulnar collateral ligament on the inside of the elbow. It's a tear of that ligament. It's what we're talking about here. The fix for this is what we call Tommy John surgery. It's also referred to as Tommy John injury. Tommy John was a major league pitcher from the 70s and even the late 60s. I think he started in the late 60s and to the early 70s. He developed, or he suffered this injury, a torn ulnar collateral ligament. A medical professional, an orthopedic surgeon, figured out a way to repair this type of injury, and it became known as Tommy John surgery. And what they're doing with this surgery is rebuilding the ulnar ligament with donor tendons. I think there are 3 different tendons that they like to use. They take tendons from other parts of the body, tendon material from other parts of the body, and they drill holes in the bones, and then they thread the borrowed tendon through the bones to replace that ulnar collateral ligament. If you would like to read more about Tommy John injury, Tommy John surgery, I can share with you a link to the Johns Hopkins website where they talk about this particular injury and the surgery, and a little bit of the history. I think it was 1974, the first year when the first surgery was performed, and it has helped a lot of pitchers over the years. A lot of pitchers have been able to continue their career after having this surgery. Before this surgical technology was developed, before this method was developed, it was pretty much the end of the pitcher's career. I mean, you are going to end up with a scar like this, but you might be able to play ball for 2 or 3 more years with this surgery. Achilles Tendonitis, a special type of tendinitis, inflammation of the Achilles tendon, result of overexertion, repetitive overexertion, and what I call explosive exertion, jumping or sprinting. The explosive exertion can actually result in a tendon tear. you don't want a torn Achilles tendon. Again, this is the Achilles tendon here. It connects the gastrocnemius and the soleus muscles in the calf to the heel bone or the calcaneus bone. And when that thing is torn, you're pretty much disabled until you're able to get it surgically repaired and it heals back up, which can be an extensive recovery time. Even a simple case of tendinitis of this tendon, like other tendinitis, can take forever to heal up. Again, I don't mean to talk about myself so much, but I've been dealing with an Achilles tendon problem since last summer. I'll have good days and bad days. I do a lot of stadium steps in my workout, and there are some stadium step workouts that I have to skip because the Achilles tendon inflammation is giving me problems. It's not so much it's not that painful, but you know it's there, and you know if you keep going, then you run the risk of rupturing that Achilles tendon. Well, and that's another good thing. That's another thing to think about when we're working with workers. Train them to know their bodies and know when they may be pushing their bodies too far. Train them to respond to the pain. A lot of workers out there, they'll work right through the pain. And when you work through the pain, a lot of times that can result in more serious injury, because pain is how we know that we're overdoing it, that something's wrong. Pain is how we know something's wrong. So if we work through it, then it can become worse. So train workers to listen to their bodies. If they've got a sore Achilles tendon, they train them to know that they should slow down a little bit in their activities. May even need to see a medical professional, which would be my recommendation. The medical professional may be able to provide treatment, medications that could aid in the healing process. Again, with bad Achilles tendon, like I said, you're disabled. You got to have a good Achilles to walk. Patellar tendonitis. It is an inflammation of the patellar tendon, which is this tendon right here. And the patellar tendon is kind of interesting. It attaches the quadriceps muscles in the upper leg to the tibia in the lower leg, but then you got this bony growth in the middle of the tendon, or kneecap, or patella, which I don't know of any other. I'm feeling my elbow now. I don't think we have a similar structure in the elbow, but that patellar structure has developed as a protective structure, protecting our knee area. But it's a unique part of our anatomy. But it's part of the tendon. But patellar tendonitis, an inflammation of this tendon, and it's the result of overexertion, repetitive use, and so on. And it's slow to heal. It's probably getting repetitive talking about all of these tendinitis disorders, because they are the result of the same types of activities, and they're all slow to heal. And it's a good idea to get medical professionals involved, I think, in many of the tendinitis cases. We can also have tendinitis of the rotator cuff tendons. The rotator cuff is a structure in the shoulder where 4 tendons form the attachments for the rotator muscles. And here is a diagram. And we hear a lot about the rotator cuff this and rotator cuff that. I think a lot of people probably don't really know what the rotator cuff is, but we talk about it so much. But this is the rotator cuff. We have these 4 tendon insertions right here on the humerus, and they connect the 4 rotator cuff muscles to the humerus. And it's a commonly injured structure within the body. You see a lot of this in the workplace. It can be the result of lifting posture, unbalanced loading, overexertion, repetitive motion, overhead lifting. I don't have overhead lifting in my list here as far as a potential contributor to the development, but overhead lifting movements, putting plywood up overhead or putting sheetrock up overhead repeatedly throughout the workday, that tends to place a lot of stress on the rotator cuff. Serious problems with the rotator cuff may require surgery. And one thing I should say about surgery, and again, a lot of people would disagree with me on this. I once you've been cut on and they've had to go in and fix something, I find it hard to believe that you're ever 100% after that. I know after my knee surgeries, never got back to 100%, and I've heard that from other people who have had different surgeries that once they cut on you, they go in and start moving stuff around or tying things up or sewing things up. You're never back to where you were before. I mean, you're able to function. Maybe you get back to 95% of what you were before the injury, maybe even 98%. But most workers, I would argue, are never going to make it back to 100% of what they were before. Of course, there are exceptions to that. But that's one thing that's a point that you might work into your training somewhere as you're training workers about the importance of preventing injuries. Remind them, hey, if you have a back injury, yeah, sure, they can fix it with surgery perhaps, but you're never going to be 100% again. If you have a knee injury because you jumped off of a piece of equipment and blew up your knee, they can fix it, but you may never walk right again. You may never be 100% again. Well, you're probably seeing a theme here. A lot of the work-related musculoskeletal disorders that are common that we're likely to encounter are tendon-related. Another one is tenosynovitis. This is a swelling of the sheath that surrounds a tendon. We haven't talked about that. We have a tendon, but if we take a more microscopic look at that tendon, we'll see that there's a protective sheath around that tendon, the synovial sheath. And tenosynovitis is a swelling and inflammation of that synovial sheath. Again, the synovial sheath, the swelling of that synovial sheath, is commonly associated with different types of tendinitis, often the result of repetitive force movements or repetitive activities. A specific type of tenosynovitis is de Quervain's disease, an inflammation of the two tendons on the thumb side of the wrist. Again, we see an inflammation of the tendons on the thumb side of the wrist, and we have de Quervain's tenosynovitis. The development of this particular disorder can make it very difficult for workers to use their thumb, to grip, to grasp, to use their thumb as it's intended to be used. If you can't use that thumb, if your thumb is not working right, it can be a disabling type of injuries. And it's oftentimes the result of those types of tasks, repetitive grasping or twisting, exertion using the thumb. When we have to exert a strong grip on an object in the workplace, especially if it's repeated, if it's a repetitive gripping action, that can develop or that can result in this particular disease. Again, once the condition develops, it's hard for the worker to form a grip, to grab things, to twist things. Any activities affecting the hand, any task that requires use of the hand is affected by this particular disorder. It can be painful, and the pain can extend into the hand and the lower arm. It's not necessarily localized in this area. It can extend into the hand and the arm. Again, to fix this, in many cases, surgery could be required. Trigger finger, stenosing tenosynovitis, painful clicking, catching when bending or straightening the finger or the thumb. The finger, with this disorder, the finger can lock into position and may need to be physically forced out of that locked position. If you've ever experienced it, it's a weird sensation. You can't straighten out your finger. You have to take your other hand and push it forward. I've had that happen a few times myself, and it's mostly old age. And all these disorders I'm talking about that I've experienced is mostly the result of age. A few injuries along the way, but mostly age. It's the result of tendons, again, becoming inflamed, becoming damaged, and instead of gliding smoothly through the tendon sheath, it is obstructed by the sheath. It gets caught on the tendon sheath, and that's the locking. Can result from repetitive motion, forceful exertion like gripping and twisting movements. It can come on suddenly and be more of an acute nature, or it can develop slowly over time and be more of a chronic type of disorder. Raynaud syndrome, or white finger. We've talked about this before. Disruption of blood supply to the fingers can also affect the nose, toes, and ears. It's characterized by discoloration, numbness, tingling, and painful sensations in the affected areas. As far as workplace exposures, it mostly affects the fingers. And we have some really good pictures here illustrating the discoloration that can occur. And that's a pretty serious case of discoloration. It's commonly caused by vibrating tools and or exposure to the cold. Cold alone can cause Raynaud's, or vibration alone can cause Raynaud syndrome. You combine the two, that increases the likelihood for the development of this syndrome. It sometimes is associated with carpal tunnel or Guyon canal disorders or other hand-wrist disorders. This particular disorder will normally be resolved or correct itself with rest, with time. But if it's not allowed to heal up, the loss of blood flow to the fingers can start affecting the tissues. You can start developing tissue loss, tissue degradation. I can't say that word for some reason. You can develop gangrene in these areas where blood supply is lost, where there's not blood flowing through those areas. So it can be serious. So if you have workers develop these symptoms, get them to a medical professional. Get that medical professional to prescribe rest for that affected worker, because that's pretty much what's going to cure their problem or correct their problem. I've had people develop this disorder, and with a little time, with a little rest, forget about the vibrating tools for a while, they're back to normal within a few days to a week. But you need a medical professional to prescribe the corrective action. Yeah, I'm going to speed it up a little bit. We've been moving along pretty slowly, and we've still got quite a few topics or points to discuss. When you hopefully you will take the ergonomics class, you'll be able to go into some of these disorders in more detail. So I'm going to, again, speed it up and talk and not elaborate so much on the different disorders that we have remaining. A class of disorders that we might see in the workplace fall into the category of degenerative disc disorders. That's when the intervertebral disc, the material between the vertebra, start to deteriorate, which can result in a number of symptoms. It can cause an impingement of the nerve, which can be manifested as pain, numbness, or weakness in different areas. In hard work, overexertion, repetitive motion over a period of time can lead to this type of degeneration. And a lot of it is age. As we get older, the disc material degenerates with time. Gravity plays a role in that degeneration as well. You will probably have workers that suffer from some variation of this type of disorder. More severe and commonly more the result of a traumatic injury would be a herniated or ruptured disc. We're still talking about the material between the vertebra, but instead of deteriorating slowly over time, it ruptures. It is injured. It slips out of position perhaps. Even if it's not herniated or ruptured, it's the movement out of its normal position can cause impingement on the nerves and result in other symptoms besides the nerve-related symptoms. Also common in the workplace, this type of disorder. Also, it's going to be associated with loading, force, repetitive force. Awkward postures also plays a role. I think here are some diagrams here that also kind of gives us a better idea of what's going on with a herniated or ruptured disc. We have a normal disc here. Here we have a herniated disc with a bulge. This series of diagrams here gives us a look at what happens as a herniation develops and progresses through different stages. Again, this is the early stage. It continues to expand and bulge. At some point, the outside covering of the disc, the annulus, is ruptured, and it just doesn't get any better from there. Oftentimes when there's injury to the vertebral discs, it's going to involve surgery, way beyond what we should be dealing with as safety professionals. Our goal, our task when it comes to this type of back injury is prevention, training workers, giving workers knowledge that can help them protect themselves from these disorders. Another back disorder, spinal stenosis, a narrowing in the vertebral column. Again, the vertebral column, there's a space that runs through, there's a canal that runs through the vertebral column, the spinal canal. Here's a normal spinal canal. With stenosis, there's a narrowing of that spinal canal. And as that spinal canal narrows, again, it can affect the nervous system. Can sometimes result in in arthritis, or it often is a result of arthritis in the vertebral column. Again, aging is a factor, along with loading and repetitive motion. Just hard work in general, along with aging, can result in this particular disorder. The lumbar region, the lower back. This is the most commonly injured region of the spine. There are a variety of specific disorders. There can be vertebral disorders, disc disorders, muscle injury in this region. Pelvic misalignment is also a problem that occurs in this region that can cause pain and other symptoms. Overexertion, again, poor posture, improper lifting, limiting load weights, strengthening the core. We're going to talk more about this when we talk about prevention, but strengthening that core musculature, that abdominal and lower back musculature that holds everything together and supports everything, is important, especially for preventing lumbar region injuries. And here's more information about the core, and we're talking about the abdominal musculature and the lower back musculature, including the gluteus and other muscles along the leg. Thoracic outlet syndrome. The thoracic outlet is this passage. Well, I think it's this passage here. It's not really, doesn't really show up that well in this diagram, but it's this passage here between the collarbone and the first rib. Blood vessels and nerves pass between those two bones, and if that passageway becomes too narrow, it can restrict blood flow and affect the nervous system, resulting in weakness, numbness in the extremities, the arms and the hand. This particular disorder, also repetitive motion, exertion, overexertion, overhead movements are related to thoracic outlet syndrome. Workers who have been swimmers or baseball players, again, this goes to the overhead movements associated with these athletic activities. Workers who have had this background may be more susceptible to developing problems with thoracic outlet syndrome. And overhead movements tend to contribute to the development of thoracic outlet problems. What else do we have here? Again, I think this close-up view of the thoracic outlet gives us a better idea of what's going on. Again, we have the clavicle, the collarbone, the first rib, and then we can see the nerves and the blood vessels being affected by that narrowing, that closing in of that area. Bursitis, we have bursa all over our bodies, at our joints. Bursa are small sacs or sac-like cavities that contain lubricating fluid or synovial fluid. The synovial fluid is lubrication for our joints. We have bursa in our shoulders, elbows, hip, knee. When there is injury to these joints, the bursa can be injured. It could be a simple case of bursitis, an inflammation and irritation of the bursa, which will generate or produce localized pain. It could be a ruptured bursa. Usually if a bursa is ruptured, it's from a more traumatic type of injury. It's not going to be the overuse. It's not going to be the chronic, long-term type of exposure. It's not going to be the repetitive motion. It's going to be a traumatic injury to the joint capsule. In some instances, in some injuries, doctors, orthopedic specialists, they examine the synovial fluid from the injured joint area, from the injured joint capsule, and from that synovial fluid they can get a better idea of what type of injury has occurred. If you've ever had a serious knee injury or other joint injury, the doctor pulls out this syringe that's got this long needle, he sticks it into the joint capsule and withdraws fluid. And from that fluid, they can get a better sense of how severely injured the joint capsule is and what the next steps may be. And it's no fun seeing that big needle. It doesn't hurt so bad, but it's no fun seeing the doctor pulling it out and knowing he's getting ready to stick it in your knee or wherever he's going to be using it. The analysis of synovial fluid, it can be used to diagnose the severity of injury, but it can also be used to diagnose other diseases or disorders such as arthritis. Wide variety of knee disorders, ankle disorders, worn cartilage, stretched ligaments, tendinitis, arthritis, bursitis. The knee injuries that I've worked with, or the workers I've worked with who have had knee disorders, it mostly results from repetitive motion, long-term wear and tear. Workers who have 20, 25 years in the industry, a lot of muddy surfaces, a lot of slopes are walking up and down, and with that type of wear and tear, there's a lot of development of knee and ankle problems. There's also the potential for acute trauma from twisting or over articulation from high energy impacts. But again, ergonomics is focused more on the long-term chronic types of exposures. And again, that's still a challenge to me. How do we, in industries like construction and oil exploration, how do we protect workers from the wear and tear of their jobs? How do we make it easier on their bodies? And I don't think there's the foolproof answer that we've arrived at yet for how we make it easier on the workers' bodies so that these types of disorders are delayed. Maybe we can't prevent it, but maybe we can delay the onset of ankle or knee problems. One of the guys I worked with, he was in his early 40s, and he pretty much had to have his ankles rebuilt, not from a traumatic injury, but from the wear and tear. He started in the construction industry when he was 18. And so by the time he was in his early 40s, he had, going on 25 years of experience, 25 years of wear and tear in the industry, a lot of slopes, a lot of rocks, a lot of mud that he was walking around in, and wore his ankles out. There are things we can do, and we'll talk a little bit about them when we get to prevention. We can do what we can to to eliminate the unstable, the uneven, the muddy, the surfaces, the work surfaces that may contribute to these problems. There's footwear that we can recommend to workers, or in some cases provide to workers, that will provide additional stability. There may be other protective devices as well that perhaps could be provided or recommended to workers to protect their knees and ankles from the long-term wear and tear. But it's really a conundrum in safety management. As our workforce gets older, we see more and more workers that they didn't have a specific injury, but their bodies are just worn out. And they're worn out, and it's work-related. It's not just age. It's partially due to the exposure they had at work. A challenge that I had to deal with, and you'll probably have to deal with yourself as a safety manager. We do our best to protect workers, but there are really challenging circumstances, like we have with knee and ankle disorders from wear and tear, that we don't have the perfect solution for preventing these types of disorders, these types of workers' comp claims. Foot disorders, a couple of common ones, plantar fasciitis, an inflammation of connective tissue, heel pain is a common symptom. The calcaneus is the heel bone. This is the plantar fascia. This is the connective tissue that we're talking about. It becomes inflamed. Bunions, the bones of the foot are displaced, resulting in a bony protrusion at the base of the big toe. May also cause an overlapping of toes, and this is the bunion here. Can be due to repetition, wear and tear. It can be the result of acute trauma. It can be the result of poorly shoes that don't fit that well. Shoes are important, and we'll talk more about this when we talk about prevention measures. But shoes are important, especially when we're talking about foot disorders, ankle disorders, knee disorders, even back disorders can be affected by the footwear that is being used by workers. So again, more on that later. Actually, more on that right now, because there are some genetic abnormalities that can be corrected with proper footwear. This is called pronation when someone walks on the inside of their foot. This is overpronation. If someone has a tendency to walk on the outside of their foot, this is called oversupination. Overpronation, oversupination can result in a variety of musculoskeletal disorders, and normally this is going to be an inherited condition, but it can be corrected with the right shoes or boots. Footwear is important, as we'll talk more about when we get into the prevention video in this unit. That gives you a rundown of some of the more common work-related musculoskeletal disorders. Again, it wasn't everything. If you take a full-blown ergonomics class, there will be other disorders that are discussed. What we did discuss are again very common, and you will probably deal with most of those at some point in your safety management career.